complications of robotic surgery. And then the surgeon goes on. Remember, this surgeon is the head of robotic surgery at a big place.
An established doctor. Sure.
And he said, quote, "Lastly, I explained that while I prefer the robotic approach, comma, there is no convincing study demonstrating clear superiority over either an open or conventional prostatectomy." Wow. Now, if a hospital has to spend millions of dollars and they're advertising this,
right,
and the patient never saw it until he came to my office, that the surgeon is saying there's no superiority of one approach over the other approach, then what the heck is going on here? What's going on?
That's certainly
what's going
surprising.
on? It's shocking. It's shocking. We're going to take your calls. We're at WABC. Our phone number is 800-848-9222, 800-848-9222. We're going to hear from our sponsor, the man with the golden voice.
Sounds very familiar, Dr. Lederman.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal, too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212 Choices, 212 Choices for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212 Choices, 212 Choices. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. Good morning. I'm here with John. We're live. We're really live. Here we are at ABC Studios. You can call us at 800-848-9222, 800-848-9222. We've talked a lot about vitamins recently, and we had a young child come in this week, 7 years old, with a brainstem glioma. The brainstem is one of the most delicate parts of the brain. It's deep in the brain. It controls movement of the face, eyes, hearing, smell, breathing. So it's very, very important. And it's one of the brain tumors that is more common in children. Okay. For some reason, children get it commonly, relatively commonly, if they're going to get a brain tumor, which is not so common. Adults don't get it very much.
Okay.
So this child and the parents came in, the mother actually. The child started on vitamins. The father was a bit angry about the possibility of getting cancer treatment for his child. So in August, he started vitamin therapy, mega vitamins and antioxidants, things we've talked about on the show, things we've shown have no data.
I was going to say, very surprising information about vitamins.
Right, it's surprising that actually the death rate is about 25% 20 to 25% higher for people with cancer who take megavitamins, antioxidants. Now, I'm not anti-anything. I'm pro-information. The whole point of this show is to give people information to try to make them live longer and be healthier. So I'm not going after the vitamin industry.
Right.
I don't have any bad feelings. If you could take one pill and make all the cancer go away,
right on.
It'd be fantastic.
Yeah.
I would love to be out of business. I'd go on the beach. I'd sit on the beach in Hawaii or someplace and live it up. It'd be fantastic if we make all the cancer go away with vitamins. That's what people are alleging, but the facts are the opposite. So this little boy, and obviously his parents love him a lot, was put on megavitamins, antioxidants in August, and he comes to us now. This is the first time he came. He came this week. He saw Dr. Eisen. Dr. Eisen specializes in tumors in the Spanish community. And the cancer grew on the vitamins. We have documented proof by MRI the cancer grew, which MRI is a magnetic test, so there's no radiation involved in it. And now the boy can't walk.
Wow.
So he's losing his neurologic function. The MRI is showing things are worse. He's on vitamins.
Yeah.
And we stress to him that with brain radiosurgery allows us to send in beams just to hit the tumor area and leave the healthy tissues alone.
Right.
So we offered him that treatment, and Dr. Eisen spent several hours with the mother and the child, hoping that we can do the right thing and deliver treatment to this boy. But the whole point is, number one, we can learn about brainstem gliomas, number one, learn about brain radiosurgery, which allows us to treat tumors anywhere in the brain,
right,
non-invasively, so there's no cutting and no bleeding. And points out, really, here's a boy with the best intentions, getting vitamins and megavitamins and antioxidants, and just didn't work.
Yeah.
So it's a lesson to us all. And if you're out there thinking that the vitamins are going to be your treatment for cancer, I'd urge you to come on in or give us a call so we can talk about it and show you the data. So we don't really want you to be misled or getting a so-called treatment that's not really a treatment. It's something actually that may well be causing progression of the cancer. We had some good news. We had a man come in this week who had esophageal cancer several years ago. He had treatment, and he said, I've got this tumor. I've got a tumor in my groin, and it's growing. It's painful. And I said, wow. He wouldn't let me examine him. He came in. We got the history. He wouldn't let me examine him. I said, okay. I said, well, why don't we get a test then to see what this tumor is in your pelvis?
Yeah, let's figure it out, sure.
Let's figure it out. Because he was worried. He said, it's growing, it's big, it's painful, and he had the esophageal cancer in the past. So we got the test, and he came into my office on Monday. He got the copy of the report, and guess what?
What's that?
He had a big hernia.
A hernia was not.
So
it wasn't as serious as you thought. Okay.
So that was good news. I mean, good news for us is that the cancer is cured, or the cancer goes away, or the cancer's in remission, or the cancer's getting better, or the pain is. So those are all good things. But sometimes there's not even a cancer.
Right.
So he came in, and there wasn't even a cancer. And another patient who called me last night, and I told him we may well talk about him today. So it's a 63-year-old man who has what appears to be a cancer in the bladder, and it may be growing into the prostate. Mm-hmm. He's seeing a surgeon, and the surgeon is apparently pushing them to have radical surgery. So a person who loses their bladder and their prostate, you can imagine their quality of life changes a lot.
Of course, yeah.
The patient and family are being reassured that they can make an artificial bladder and everything's going to be okay. But first of all, there's technology over the last 20, 25 years that show that we can do other treatments that have an equal chance of curing the patient and keeping the bladder intact.
Less effect on everyday life.
So if you can urinate normally and have normal sexual function and not go through radical surgery, we think it's better.
I would think so, too.
But the medical facts at least show it's equal. So you're not losing anything medically in a chance of being cured, and you may be avoiding radical surgery, which is always difficult. And even if you have an artificial bladder made, usually there's a catheterization process that's repeated every day for the rest of your life. So it will change the quality and nature of your life.
Yeah.
And there's no guarantee that the surgery is going to work. There's no guarantee in medicine anyway, but you can go by the statistics, and with statistics, you have a pretty good idea about what's going on. So that was interesting. At the cancer meetings at New York Rankin Society, there was a lot of information provided, some about cervix cancer, which is one of the more common cancers in women. Cervix cancer can usually be avoided by Pap smears. We talked earlier this year about the use of vinegar testing. If you remember, in India, for 10 cents, you can use vinegar on the cervix and diagnose cervix cancer.
Yeah. Which I thought was amazing.
Which is amazing. Yeah. You can save thousands of lives using vinegar and a lamp and a person with a 10th grade education to pick out women that are at higher risk for cervix cancer. So it's important to have the Pap smear and the mammogram on a regular basis. So for cervix cancer, staging is important. We need to know, for those women who have cervix cancer, where the cancer is. And PET scans are usually used. PET scans are an injection of radioactive sugar. It usually goes to the tumor area. So PET scans are used, or MRIs are used. And usual treatment is a form of chemo and radiation, and studies have shown improved outcomes. So you can have a higher cure rate. And studies show that, and it was again reported this week at the New York Rankin Society. In fact, you can increase your chance of going into remission by about 30% with chemo and radiation. There's a marked improvement in progression-free survival, which means to stop the cancer and not come back. There's data showing improved survival. The people who are at highest risk, human papilloma virus. I don't know if you've heard about it, but there's a vaccine now.
Yeah.
And a lot of young children, girls, and now boys are getting vaccinated against human papilloma
before they're
virus.
Potentially exposed to it.
When they're even before they're in puberty.
Okay.
So it's vaccinating them to decrease the risk, because human papilloma virus is so prevalent in our society.
Sure.
So there have been some parents that have been opposed to it because it implies that children will be sexually active, but probably most children will be eventually sexually active.
Right, at some point.
And if you can do something to prevent the risk of human papilloma virus, it probably is well worth it. Remember, Michael Douglas had the head and neck cancer, the cancer of the mouth, and that was related also, he said, to oral sex and human papilloma virus. And right now there's an epidemic in America in men getting cancers of the mouth related to human papilloma virus. So it's not only diseases for women and girls, it's also for men and boys, and one should consider the vaccine. We have Dr. Paul Offit, who's an expert on vaccines, is going to be back on our WOR show on Sunday night, November 10th, and we're going to look forward to that.
Awesome.
It's about the end of the hour, believe it or not. So if you haven't got your question in or want to ask privately, you're welcome to call our office phone number, 212-CHOICES, 212-CHOICES, which is 212-246-4237, 212-246-4237. We have a free booklet and a DVD to send to you, so we'll send you both the booklet and DVD if you call us. If you have questions, please feel free to call in or come in and get the booklet and information. Thank you very much. Thanks, John.
All right, Doctor.
All your listeners, God bless you.
Have a great weekend.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Aaron Katersky. Some hopeful rumblings this morning out of Washington. ABC News. I'm Aaron Katersky. Some hopeful rumblings this morning out of Washington. ABC News. I'm Aaron